you for the question. I mean, this is something that I'm always proud to talk about. Malaysia is very competitive in terms of medical tourism, as you all can see in the papers, and as we grow. And that's through a constellation of factors. And these factors actually orchestrate why a patient chooses to come to Malaysia. Now, first of all, we look at quality. Yeah, when I talk about quality, it's about the quality of the hospitals, the doctors, and the service that we provide. We have almost about 16 hospitals with JCI accreditation, and a couple of them with ACHS, which is the Australian accreditation. Accreditation means they sustain a high-level standard of quality. Yeah, that promises a patient who Googles about this hospital to understand at what level of safety and quality and care that they can expect. That drives them. On top of that, now we get a lot of feedbacks to understand why patients love coming to Malaysia. They talk about our doctors. They talk about the trust in the diagnosis that we give them. A lot of countries, I'm not going to name them to be fair, but a lot of them come to us and tell that they get misdiagnosed, even with technology, but they trust our doctors. So that's something that we need to be proud of, right? And together with the trust, we give them the right advice that they are comfortable with. And then comes the treatment. Now, if you look at our doctors, right, to be a specialist and a subspecialist coming to the private sector, you need at least 14 to 16 years, right? You do your housemanship, MOship, so on and so forth. Compared to a lot of other countries, our pathway is longer, but then we ensure the quality. So this definitely sells and puts Malaysia in the forefront to know that we have trustworthy doctors with the right quality to give the treatment. Now, a lot of you would have definitely also seen that we are cost effective, or rather competitive in pricing compared to our neighboring countries. Now, this pricing not only comes to complex procedures, but even simple things like a medical checkup, yeah, a proper screening, up to the most complex procedures like cancer treatments. We are still competitive compared to a lot of countries that are neighboring us. And then, of course, we can't deny the seamless connectivity that we have. Two aspects of that. One is the airports. We are very geographically, strategically positioned as a country where it's easy to fly in, and from the airports or wherever they are in Malaysia to go to these major hospitals. That's not a problem at all. Most of the hospitals actually provide transport. The ambulance waits for you to pick you up, and this gives comfort for them to choose to come to here. And we cannot omit the fact of the hospitality that we have now. You know, we are known as a friendly nation. Malaysia is truly Asia. We are multi-diverse in culture, and we know how to be friendly with them. I mean, it's just part of what we do. And finally, what's really picking up now is the Muslim-friendly aspect in Malaysia, right? A lot of them are going into that to attract a lot of people, especially from the Middle East or even any other countries. I mean, for now, the biggest tourism comes from Indonesia, right? Culturally, we are almost similar. The fact that we are Muslim-friendly actually gives them the extra comfort to come here. So I think both of these elements, right, the quality of care that we provide together with the hospitality service definitely makes us as a booming nation when it comes to medical tourism.
All right, thank you very much, Dr. Vicknesh.